15-minute or less lecture series, Human Anatomy, Chapter 7, the Skeletal System, the Axial Skeleton, Part 2. So, we covered the skull with its 8 cranial bones and 14 facial bones. We're now moving to the bones of the axial skeleton separate from the skull. First up is the hyoid bone. The hyoid bone is a U-shaped sort of bone found in the cervical area. It has attachment sites for many muscles going to the tongue, coming from the neck, attaching to the larynx, often considered the superior portion of the larynx structure. This is the only bone of the body not articulating with another bone. It does not articulate with another bone. It has two horns sticking out from the body. You have the two greater horns, right and left, and then these two little spikes called the lesser horns, and then, of course, the body in the center. The vertebral column is a long column of bones that house and protect the spinal cord. That is a flexible, strong rod for movement, helps to support the head, and provides attachments for the ribs, the pelvic girdle, the pectoral girdle, and the muscles of the back and upper limbs. The vertebral column has 7 cervical vertebrae, 12 thoracic vertebrae attached to ribs, 5 lumbar vertebrae, 1 sacrum, and 1 coccyx. The sacrum and the coccyx happen to be made of fused vertebra, fused when we were children. If you remember how many cervical, thoracic, and lumbar vertebrae, you just think of breakfast, lunch, and dinner. 7 o'clock is breakfast, 7 cervical. 12 o'clock is lunch, 12 thoracic vertebrae, 5 o'clock is dinner, 5 lumbar vertebrae. There are also intervertebral discs between each vertebra and between the last vertebra and the sacrum. This intervertebral discs are made of fibrocartilage, and their function is to help to endure compression and absorb shock, and allowed for some of that flexibility in the vertebral column for some slight movement. It is possible for an intervertebral disc to get damaged, causing the internal, slightly more gel-like nucleus pulposus to push outward because of damage to the more fibrous outer annulus fibrosus. This portion pushing outward can then push on a spinal nerve, leading to pain. All right, the vertebral column has natural curvature. You have an anterior or convex curvature of the cervical vertebra, the thoracic curvature that is more concave, the lumbar curvature, which is more convex, and the sacral curvature, which is more concave. Some abnormalities in the curvature include scoliosis, where there is abnormal lateral curvature to the vertebral column. There's kyphosis, where there is an exaggerated curvature of the thoracic region, sometimes called a hunchback, very common in the elderly. And then lordosis, abnormal curvature of the lumbar region, sometimes called swayed back. And while this can occur in a woman who's pregnant, it can occur in anybody and maybe even make them look pregnant as the abdominal organs get pushed forward. Here is the typical vertebra, a generic vertebra. Things almost every vertebra possesses is a vertebral body, this large portion of bone. And then there is the tissue that forms the vertebral foramen, or the hole where the spinal cord passes through. The tissue that helps to form the vertebral foramen, besides the body, includes the pedicles, this region of tissue, and the lamina, this region of tissue. So you have 2 lamina, 2 pedicles, and the body, making the vertebral foramen. Here's another view of the vertebral foramen with the pedicle, the lamina, pedicle, and the body. Structures that come off of the pedicle and lamina include the transverse processes. They stick out laterally, and the spinous process, which sticks out posteriorly, and these are attachments for muscles. Here they are. You also have the superior articulating process and the inferior articulating process. These processes then help to form joints with the vertebra above and below it. Here's the intervertebral discs, the body, the intervertebral foramen. This hole you only see when you have 2 vertebra helping to coming together. And the intervertebral foramen is where spinal nerves leave the vertebral column. The 7 cervical vertebrae have 2 special structures specific to them. They have the bifid spinous process, where their spinous process actually goes into a fork rather than a point. Although some of them don't. but for the most part they do. And then they have the transverse foramen. The transverse foramen are holes found in the transverse process, only found in cervical vertebrae. The very first cervical vertebrae looks even more unique. So C1, known as atlas, possesses a posterior arch and no spinous process. That then becomes this dense bit of bone tissue called the lateral masses rather than a body, and then the anterior arch, which will articulate with the dens of the axis. There is the superior articulating facet, this smooth concave area that will fit with the occipital condyles of the occipital bone. Below that is C2 is axis. Axis looks mostly like a normal cervical vertebra, except it has this portion of bone sticking up superiorly. And this is called the dens. The dens then articulates with the atlas, forming a joint that lets us rotate our head in the motion of no. Next up comes the 12 thoracic vertebrae. The 12 thoracic vertebrae have additional facets. These facets allow them to articulate to form joints with the ribs. So it'll have a facet on its transverse process for articulating with the tubercle of the rib. It'll have a superior demifacet on its body for articulating with the head of the rib, and a inferior demifacet on its body for articulating with a different head of a different rib. The largest of the vertebrae are the lumbar vertebrae, and other than that, they're pretty ordinary. All right, so cervical vertebrae have transverse foramina. Thoracic vertebrae have extra facets. Lumbar vertebrae, big. That's how you tell them apart. Sacrum, again, 5 fused vertebrae, followed by the coccyx or tailbone, which is 4 fused vertebrae. The sacrum has superior articulating processes that articulate with lumbar, that should be an L, lumbar 5. It has on its lateral sides a rough area that will form an attachment with the pelvic girdle. This is a fibrous joint that does not move, and so it's called the auricular surface. There are little faint lines going across the middle of the sacrum. These are the transverse lines formed when the various vertebrae fuse together. And then the point at the end of the sacrum is the apex of the sacrum. Flip it around, you see there's an opening leading to a canal. This is called the sacral canal. It passes through the sacrum and then ends with the sacral hiatus. And there are spinal nerves that pass through this canal. On the lateral sides of the posterior side of the sacrum are this ridge called the lateral sacral crest. And then there's also a ridge in the middle called the median sacral crest. And then these openings are sacral foramen. Then we come up to the thorax or thoracic cage. Thoracic cage is very important. It encloses and protects various organs of the thoracic cavity, provides support for the upper limbs, aka where the pectoral girdle attaches, and aids in breathing. The sternum or the breastbone has 3 main regions: the manubrium, the body, and the xiphoid process. On the manubrium, you have 3 little depressions called the right and left clavicular notches that articulate with the clavicles, and then the suprasternal notch. There are 12 pairs of ribs, 12 on the right side, 12 on the left side. They are called rib 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, right or left. Many of them are attached to the sternum via costal cartilage, which is hyaline cartilage. The very edge of the hyaline cartilage is referred to as the costal margin. Spaces between the ribs are intercostal spaces. Turns out ribs 1 through 7 are also known as the true ribs because they connect directly to the sternum. Ribs 8, 9, and 10, and 11 and 12 are known as false ribs. Ribs 8, 9, and 10 attach directly to the costal cartilage of rib 7, so they do not connect directly to the sternum, while ribs 11 and 12 do not attach to the sternum at all. Hence, those are the 5 false ribs on each side. And then ribs 11 and 12 are also known as floating ribs because they do not attach to the sternum at all. The rib has a head, and after the head comes the neck. The head has 2 little facets for articulating with the vertebra's body. The rib also has a tubercle, which has a facet that articulates with the rib's transverse, thoracic vertebrae's transverse process. And then this long portion is referred to as the body of the rib. So here you have a rib coming in, it's tubercle articulating the transverse process of the thoracic vertebra, and one of its facets articulating the demifacet of the vertebra, and then another vertebra will lay on top of it and articulate with the other facet on the rib's head. So that you have one rib forming three articulations with two vertebra.